Welcome to the Omnidental Podcast. So I want you to imagine biting into this like really crisp apple and you feel this sudden, sharp crunch.
Oh no.
Right. And then you get that immediate stomach-dropping realization that the crunch wasn't the apple, it was actually your tooth.
Yeah, that is a terrifying moment. I mean, absolute panic.
Totally. And in that moment, you are suddenly thrust into this major crossroads in modern medicine, which is restorative dentistry.
And, most people approach that moment thinking of their tooth as just this isolated mechanical thing, like a pothole in the road, basically.
Oh, like you just drill out the bad asphalt, pour in some filler, and drive away.
Exactly. But framing it that way completely misses the profound biomechanical reality of what's actually happening in your mouth.
Which is exactly why we're doing this deep dive today. We are pulling from this highly detailed guide authored by Dr. Bellis Pohls, and our mission is to basically tear down that pothole myth.
Right. We really need to understand the actual engineering behind the two main tools dentists use to rebuild a smile, which are, veneers and crowns.
Yeah, so we're going to look at the physics, the materials, and honestly, the biology that dictate which one you actually need.
But to really grasp those mechanics, we have to start by looking at the environment where these decisions are made, because the clinical environment dictates your psychological state as a patient.
Oh, 100%.
Yeah, right.
And that dictates the quality of the care. So bringing it back to Dr. Pohls, he leads Omnidental in MedSpa. They're headquartered in Arlington Heights, Illinois, but they serve this massive web of surrounding communities.
Right. It's a huge area.
Yeah, so we're talking Buffalo Grove, Palatine, Mount Prospect, Rolling Meadows, Schaumburg, Wheeling, Des Plaines, and Elk Grove Village.
And what is structurally fascinating about this practice is, well, it's that dual identity you just mentioned.
The med spa part.
Exactly. It is a state-of-the-art dental clinic, but it operates simultaneously as an aesthetic med spa. And I actually want to pause on that because it's not just a clever marketing label. It fundamentally re-engineers the whole healthcare model.
How so?
Well, think about the physiological response most people have when they walk into a standard dental clinic.
Well, it's immediate fight or flight.
Yeah.
You smell that sterile clinical scent of eugenol, I think is called, that clove oil smell.
Yes, exactly.
And you hear the high-pitched whine of a drill behind some closed door, and your cortisol levels just spike. You grip the armrest. You are in a defensive, reactive state before the doctor even says hello to you.
Right. Your nervous system is essentially bracing for trauma. Now, contrast that with what they call a wellness hub model.
Okay.
When you integrate dental services with med spa aesthetics, so things like skin rejuvenation, laser hair removal, Botox, dermal fillers, IV drip therapy, you are completely changing the sensory and psychological inputs.
So the patient isn't just walking into a pain management center.
Exactly. They are entering an environment designed for comprehensive self-care. It shifts the brain from that sympathetic fight or flight mode into a parasympathetic, rest and digest state.
Yeah, that makes sense. If you know you're getting a skin rejuvenation treatment right after your dental exam, the whole visit feels proactive instead of reactive.
And from a purely clinical standpoint, a relaxed patient is just easier to diagnose. They're easier to treat. And they actually heal faster because their body isn't flooded with stress hormones.
Wow, I never really thought about the healing aspect of just being relaxed.
Yeah. That's why integrating advanced diagnostic tech and eco-friendly practices with a med spa environment, it isn't just about luxury. It's about optimizing the baseline physiological state of the patient so the actual restorative work actually succeeds.
Okay, so let's get into that restorative work. Let's assume you're sitting in that relaxed, proactive environment, and you're told that a tooth needs serious intervention. You basically face two distinct pathways, right? A veneer or a crown.
Broadly speaking, yes.
I want to break down the what and the where of these tools. Let's start with veneers. At a structural level, what actually is a veneer?
So a veneer is an incredibly thin, custom-manufactured shell. And the defining biomechanical characteristic here is that it is bonded only to the front-facing surface of your tooth.
Okay, so the back of your tooth, like the part your tongue touches, that remains completely natural.
Exactly. Because it only covers the front, the dentist only needs to remove a microscopic fraction of a millimeter of your natural enamel to make room for it. It is highly, highly conservative.
Whereas a dental crown is like the complete opposite in terms of its footprint.
Oh, completely.
A crown is a full cap. It encapsulates the entire visible structure of the tooth all the way down to the gum line. And to fit a full cap over a tooth, without it looking like, a giant marshmallow, They have to aggressively reshape the natural tooth, right? Like
Right.
filing it down into a much smaller peg.
Yeah, that's exactly right. If we visualize the tooth as a house, placing a veneer is like adding a beautiful custom brick facade to the front of the house to maximize curb appeal.
So you aren't touching the load-bearing walls or the foundation.
Right. But a crown, however, is a total structural rebuild. You are replacing the framing and the roof to keep the entire building from collapsing under its own weight.
And deciding between the facade and the structural rebuild, that really comes down to the biomechanics of where the tooth actually lives in your mouth. Because front teeth and back teeth experience entirely different physical forces.
The forces are wildly different. Your front teeth, the incisors, they act like scissors. They are designed for shearing forces.
Like when you bite into a sandwich?
Exactly. You bite into a sandwich, you sever the bread, and then your tongue moves the food to the back of the mouth. Because front teeth don't bear the brunt of heavy, repetitive crushing, they are the prime real estate for veneers.
So you can achieve maximum aesthetic improvement, like fixing chips, gaps, or deep discoloration, without needing heavy structural reinforcement.
Exactly. But the molars in the back are basically the body's mortar and pestle. They endure massive compressive forces. I mean, the human jaw can exert up to 200 pounds of force per square inch on the molars during mastication.
Wait, 200 pounds?
Yeah, it's intense. So if a back molar is compromised by decay or a fracture, sticking a thin porcelain facade on the front of it would be totally useless. The downward crushing force would just shatter the tooth.
So that is where crowns become an absolute necessity. They provide a 360-degree distribution of those compressive forces, shielding the underlying damaged tooth structure.
Exactly.
Okay, that makes perfect sense. Front of the mouth equals shearing force and aesthetics, so veneers work.
Yeah.
Back of the mouth equals massive compressive force, so crowns are required.
All right, that's the basic rule of thumb.
But once you know where the restoration is going, you have to decide what it's made of. And looking at the guide, the material science here is honestly fascinating because it's this constant tug of war between aesthetics, durability, and cost.
It really is a balancing act.
Let's look at the veneer materials first. Dr. Poles highlights two main categories, right? Porcelain and composite resin.
Yeah. Porcelain is traditionally considered the gold standard in cosmetic dentistry.
Because it looks so natural.
Exactly. And it comes down to how light interacts with the material. Natural tooth enamel is slightly translucent, so light penetrates it and reflects off the opaque dentin underneath.
Okay.
Dental porcelain mimics this optical property almost perfectly. Furthermore, porcelain is vitrified. It's fired in a high-heat kiln until it becomes a dense, glass-like substance.
Oh, so because it's essentially non-porous glass, it is incredibly resistant to stains from, like, coffee, wine, or tobacco.
Precisely.
And the guide notes they last an impressive 10 to 15 years. But then we have composite resin veneers. These are essentially a mixture of plastic and fine glass particles. They're more affordable, but they only last 5 to 7 years.
Right.
And because the resin matrix is slightly porous, they can absorb tannins over time and stain, which naturally leads to a fairly obvious question.
I think I know where you're going with this.
Yeah, I have a major point of confusion here. If porcelain lasts twice as long, completely resists stains, and looks more natural, why on earth would any patient choose a composite veneer? It feels like you're just signing up for an inferior product that you'll have to pay to replace in 5 years anyway.
It definitely seems counterintuitive on paper, but it ignores the pragmatism of clinical dentistry. See, porcelain is beautiful, but it is rigid and it's brittle.
Okay.
If you bite down on a fork and chip a porcelain veneer, you generally cannot just patch it. You have to remove the entire shell, take new impressions, send it back to the lab, and pay for a brand new veneer.
Oh, wow. So a tiny chip ruins the whole investment.
Completely, but composite resin is fundamentally different. It is applied and sculpted chairside by the dentist. If you chip a composite veneer, you can literally walk into OmniDental, sit in the chair, and the dentist can bond new composite material directly onto the chipped area.
I get they just blend it in.
Yeah, seamlessly blending it in a single visit.
It's patchable.
It's highly patchable. So for a patient who might be on a strict budget or someone who is prone to grinding their teeth and has a high risk of chipping or restoration, composite becomes a highly viable, pragmatic choice.
So it requires more maintenance, yes, but the maintenance is cheaper and faster.
Exactly.
That highlights why personalized treatment is so critical. You can't just look at a spreadsheet of lifespans and pick the highest number. You have to evaluate the patient's habits,
Right.
which brings up the materials used for crowns, because the demands there are even higher.
For crowns, you have metal options like gold or base metal alloys. These are virtually indestructible and wear down at the exact same rate as natural enamel, which is great for the opposing teeth.
But, I mean, they look like metal.
Right, they look like metal, so they're usually relegated to the very back molars where nobody can see them.
And then you have all ceramic crowns, which offer that beautiful translucency we talked about with porcelain veneers, making them great for front teeth that need full coverage.
Yes, exactly.
But the guide points out a third option that acts as a hybrid: porcelain fused to metal, or PFM crowns. The guide calls them the best of both worlds.
Because they solve a very specific engineering problem. You get a thimble-like base of strong metal that fits over the tooth, providing immense structural integrity against those 200 pounds of biting force we talked about.
Right.
But that metal base is layered with aesthetic porcelain that is baked on, allowing the tooth to blend in with your natural smile.
Okay, so we've covered the materials, if you're getting the facade or the structural rebuild. But let's talk about the reality in the chair, specifically when it comes to crowns. Because the guide mentions that crowns are incredibly common and often mandatory after a root canal.
Yes, very common.
And I think we need to unpack why. Because, wait, if a root canal hollows out the inside of a tooth to clear an infection, why not just pull the whole tooth out? Why go through the expensive trouble of reshaping a hollowed-out tooth just to put a crown over it?
That is a crucial question. You always want to preserve the natural root of the tooth in the jawbone, if possible.
Why is that?
Because when you extract a tooth completely, the jawbone in that empty space loses the mechanical stimulation from chewing. Without that stimulation, the bone literally begins to resorb or melt away, which can alter your facial structure and cause neighboring teeth to shift.
Oh, so the root acts like a tent pole, keeping the bone structure intact.
Exactly. It's a great analogy. A root canal removes the infected living tissue, so the pulp, the nerves, the blood supply, from inside that tent pole. But the structure itself remains in the bone.
Right.
However, because it no longer has a blood supply, that remaining tooth structure becomes dead wood. It dries out, it becomes incredibly brittle, and it is highly susceptible to shattering.
So if you just left a root canal tooth without a crown, it's basically a ticking time bomb.
Yeah.
The first hard pretzel you bite into could just split the tooth in half.
Precisely. The crown acts as the structural hoop around a wooden barrel, holding the brittle pieces together so you can maintain the natural root without fear of it fracturing.
Got it. And when designed and placed correctly, crowns are an incredible long-term investment. They boast lifespans of 15 to 25 years.
But there's a massive caveat to that quarter-century lifespan. A 25-year rating isn't a warranty, it's just a potential. The guide stresses that patient satisfaction is high, but these restorations are absolutely not invincible.
Right, they're essentially highly engineered prosthetics. And just like any prosthetic, longevity depends entirely on how the user treats it.
You can't just install a porcelain-fused crown and suddenly start opening beer bottles with your teeth.
Yeah, please don't do that.
You still have to practice meticulous oral hygiene, you still need regular exams and cleanings, and you have to stop using your teeth as tools. No chewing ice, no biting pens.
So the dentist provides the state-of-the-art material, but you provide the biological environment it lives in.
Exactly.
Which perfectly transitions to a threat the guide explicitly highlights. A threat that can completely destroy even the most flawlessly executed top-tier porcelain restoration. We are talking about the silent saboteur of cosmetic dentistry.
Gum disease.
Gum disease. It doesn't matter if the roof of the house is made of titanium, if the foundation underneath it is crumbling.
Absolutely.
And I actually want to move away from structural analogies here and look at the biology, because people misunderstand gum disease. It's often described as just a bacterial infection. But the damage isn't just the bacteria eating your gums, right? It's actually your own immune system overreacting.
That's a brilliant way to frame it. Think of your immune system like an overactive fire sprinkler system in an office building.
Okay.
The bacterial plaque that builds up around your gum line is a small fire in a trash can. It's harmful, but it's contained.
But instead of just putting out the small fire, your body's immune response triggers the massive sprinklers for the whole floor.
Yes. The body sends inflammatory cells to fight the bacteria. But this chronic aggressive inflammation doesn't just attack the bacteria, it starts breaking down the healthy collagen in your gum tissue.
Oh, wow.
And if left untreated, that inflammation penetrates deeper and signals specialized cells called osteoclasts to start dissolving the actual jawbone that anchors your teeth.
So the body essentially destroys its own floorboards trying to put out the trash can fire.
Exactly.
And that is advanced periodontal disease. The bone melts away, the gums recede, and eventually the tooth just becomes loose. And if that happens, it doesn't matter how gorgeous your $10,000 porcelain veneers are, the teeth they're glued to will literally fall out.
Which is why the warning signs Dr. Pohl's lists are so critical to catch early. Red or swollen gums, persistent bad breath, which is actually the sulfur gases released by the bacteria trapped in deep pockets, and bleeding when you brush.
Let me stop you there, because the bleeding aspect is something we normalize wildly. People see a little pink in the sink when they floss and they think, oh, I was just too aggressive with the floss today. We just dismiss it.
We do?
But if your scalp bled every time you washed your hair, you'd be in the emergency room.
That is so true. It is the earliest sign of that inflammatory cascade, and stopping that cascade is the non-negotiable prerequisite to any cosmetic work.
Right.
This is why a comprehensive clinic like Omni Dental doesn't just jump straight to measuring you for veneers. They prioritize the foundation. They utilize deep teeth cleaning, scaling and root planing, and even laser therapy to eradicate the disease first.
And the laser therapy is fascinating.
Yeah.
I mean, how does a laser treat gum disease better than just scraping the teeth?
It's based on a principle called selective photothermolysis.
Selective photothermolysis.
Yeah. Certain dental lasers are calibrated to a specific wavelength of light that is only absorbed by dark colors. The bacteria that cause severe gum disease are often darkly pigmented, and the inflamed diseased tissue is a dark, angry red.
While the healthy gum tissue is like a light pink.
Exactly. So the laser vaporizes the dark diseased elements, but literally passes right over the healthy pink tissue without cutting it.
Wait, really? It just targets the bad stuff?
Yes. It sterilizes the periodontal pocket at a microscopic level with minimal trauma, allowing the healthy tissue to quickly reattach to the tooth root. It's biomechanical engineering applied to immune response.
That is amazing.
Once you have cleared the bacteria and stopped the immune system's sprinklers, the foundation is stable, and then you can build the house.
That is an incredible intersection of biology and technology. So let's synthesize all of this for you listening. If you are sitting at this crossroad, your decision requires evaluating several layers. Veneers are your cosmetic facade, utilizing shearing force on the front teeth with minimal enamel removal.
And crowns are your structural rebuild, providing 360-degree compressive force protection for damaged or root-canaled teeth.
You then have to navigate the material science. So balancing the aesthetic brilliance and longevity of kiln-fired porcelain against the budget-friendly, repairable pragmatism of chairside composite resin.
And above all else, you have to maintain the biological foundation. You cannot ignore the bleeding gums. You have to manage the plaque so your immune system doesn't dissolve the jawbone, supporting the entire apparatus.
All of this demands a highly skilled partner, which is why integrated practices like Omni Dental and MedSpa in Arlington Heights are designed to manage every variable, from the bacterial foundation all the way to the final cosmetic polish.
So as you look at your own smile, the question to ask yourself isn't just, do I need a veneer or a crown? Ask yourself what your ultimate goal is. Are you trying to establish structural integrity so you can chew without pain? Are you seeking an aesthetic enhancement to boost your confidence? Or are you looking for a comprehensive reset of your oral and physiological wellness?
And as you ponder what your smile goals actually are, I want to leave you with a broader thought about the future of this kind of care. We started by exploring how Omni Dental integrates a state-of-the-art dental clinic with aesthetic med spa services under one roof. They are treating gum disease with precision lasers on one side and offering dermal fillers and IV therapy on the other.
Which points to a massive paradigm shift. As biomaterials become increasingly sophisticated, to the point where lab-grown enamel or prosthetics might literally outlast our own natural lifespans, and as these clinical spaces evolve to optimize our psychological comfort, the traditional boundaries of medicine are dissolving.
Exactly. How far will that blur go? In 10 or 20 years, will the distinction between traditional drill-and-fill healthcare and elective cosmetic enhancement completely vanish?
This is a fascinating question.
Could walking into the dentist to fix a broken molar eventually feel entirely indistinguishable from spending an afternoon at a luxury spa?
The science and the environment are certainly trending in that direction.
It fundamentally changes what it means to take care of yourself. Well, thanks for joining us on this deep dive. Until next time.